Welcome back to Open BxRx. COVID-19 presents risks and challenges for people with disabilities around the country. Vision Services for the Blind and Visually Impaired continues to provide services and resources to those in need during this pandemic. Joining us now with more information on their services is Vision's Executive Director, Nancy Miller. Thank you for joining us, Nancy.
Thank you for having me.
I'm sure that this pandemic has impacted Visions. You're all about family, community, and support at Visions. And from what I've witnessed when I visited one of the centers, that's what it's all about. It's tight knit. Everyone's always together and supporting each other.
Well, thank you. We work very hard to make sure that we're communicating as well as we can and giving each other support.
Right. To start, Nancy, can you just tell us a little bit about Visions?
Sure. So we're a 94-year-old nonprofit social service organization. We serve over 7,000 people a year. We provide services in all 5 boroughs of New York City, Long Island, Westchester, and Rockland County. And we're now serving the northern counties of New Jersey.
And can we talk about the impact that this pandemic has had on the blind and visually impaired? What are some of the challenges that should be addressed during this time?
Well, the first difficulty we operate an adapted senior center for people who are blind. It's one center in all of New York City, and the seniors, over 800 seniors, were traveling to the center for daily activities, for meals, as well as opportunities for training. And also, many of the staff at the senior center are blind seniors themselves who are getting paid to operate classes. So the first concern, of course, was congregate activities. People were told to do physical distancing, which meant that many of the center members were afraid to attend. People were getting 1 or 2 meals a day at either no charge or with a very small contribution. And so people were very nervous about how they would get their meals if they were no longer able to get to the center. We also know that many of the announcements around the pandemic happen on a visual tape at the bottom of the TV programs that blind people are not able to access because they can't read it.
Mhm.
Um, and if they can access it through their cable provider or their TV provider, they don't know how to turn that on. That makes it a verbal announcement as opposed to a visual one. The kinds of emergency calls we've been getting are not only for blind seniors, but also for blind people with disabilities who used to be able to go out to a local store, a bodega, a supermarket, but are now so fearful of leaving the house that they were interested in home delivered meals, but they didn't know how to access them if they weren't already getting it through a senior center. So we've had to share information with our constituency about the resources available. Fortunately, we are very well connected. So if I wasn't able to answer a question, I could throw the question out to the staff, to our partners at the New York State Commission for the Blind, through the American Council of the Blind, National Federation of the Blind, through the Mayor's Office for People with Disabilities. You send the question out, and at least 50 people come back with the answer. If it exists through our network, we're able to get it, and then we can get that information back to the individual. And because we're able to provide services in 16 different languages, we have people who are asking us information in one language, and then we're able to get the information back to them through our staff who speak that particular language. Most people are contacting us now through info at visionsvcb.org. That's info, INFO, at VISIONSVCB.org. nsvcb.org. That's the quickest way to get a response. That actually goes to me as the CEO, and then I distribute it to the staff person that I think is able to answer the question most quickly. We're also responding to questions that are coming through our website, www.visionsvcb.org. Our live receptionists are picking up all phone messages and distributing it to the right person on the staff. If they're not sure who the question should go to, then it gets sent to me and I will answer that question. All 104 of our staff right now are working remotely. Last week, we had 11 staff members, including many who were blind, who volunteered to continue to go into the senior center to distribute the pick up and go meals. They couldn't eat them together, but as long as they could get to the center, they could pick up the meal. Fortunately, now everybody who had been signed up for the senior center is now getting home delivered meals through the New York City Department for the Aging. And we've been checking in with all of our center members and all of our rehabilitation participants, all of our youth services, all the families that we're serving. We're using the time now to make phone calls and communicate through email to make sure that people are getting the support that they need, encouraging everybody to stay home, wash hands, giving them the information about the signs of the COVID-19, what they should be watching out for, and making sure that they feel connected. The feedback we've gotten from our participants has been really positive, that they know that Visions is there, they feel supported, they feel connected, because we're most concerned about social isolation. It's one of the biggest difficulties that blind people feel, especially in a time where you're supposed to remain at home. If you live at home and you don't have internet connection, you don't have a computer at home that you can use, it can be extremely isolating. So those phone calls and those check-ins and letting them know how to reach us has made a huge difference for them. We're also providing technology support for blind college students that are now taking all of their courses online. If they need technology help, we have our technology trainers who are available to do remote help desk, and they will call the college student and walk them through how they can connect to the course that they're trying to take, and making sure that the accessibility features are turned on. We're also helping public school students with the same problem. What we find, however, particularly for our Bronx participants, but true throughout New York City, we serve a relatively low income population. And many of the students, the adults, and the seniors that we're working with do not have internet connection, do not have accessible computers. So sometimes it's getting them the hardware first and making sure they know how to connect into the free internet before we can give them the help to connect to their class. So
Right.
it's a 2 or 3 stage process.
So it's safe to say, Nancy, that Visions has adapted to this remote services and continues to provide the support and resources during COVID. Can you just elaborate on the services that are being offered? I saw the newsletter earlier today.
Right. So we're offering a phone check-in with all of our senior participants. We're offering technology assistance through our help desk. We're offering some remote training for people who are new to blindness some indoor mobility tips, some tips on how to manage as a visually impaired person, things that we can do remotely that do not require that we actually be in the home, since most of our services up until now were provided in the home or in the community. We're doing Google Hangouts and Zoom and all types of chat groups for those who are technologically a little more connected.
Mhm.
We're doing some work readiness groups remotely. We're doing youth services remotely, where we're connecting through Zoom, which is pretty accessible for blind people. And so that's enabled us to do some small group training, which we're continuing to do. Our senior center is completely closed as required by the New York City Department for the Aging. So we're looking for other ways to stay in touch with the older adult population. We're also doing some pretty intense social work counseling. We had many of our participants who were adjusting to blindness, but now there's a lot of anxiety around COVID-19, and our 9 social workers are providing free mental health counseling, both short term as well as related to adjustment to blindness. So those social work counseling sessions are continuing, and we've gotten some new referrals of people that we hadn't been serving before. We're still accepting applications for service. They can be emailed to us. We're connecting people to the New York State Commission for the Blind. They're still processing applications. It's just taking a little bit longer since it's all being done remotely. But we're encouraging anybody who is legally blind, who meets the federal definition of legal blindness, to get in touch with us, either through phone or email, and we will try to help out. Today, I got a desperate email from a 36-year-old Bronx resident who is legally blind and disabled and has a 17-year-old daughter, and she is running out of food. And
Mm.
she had no idea how she was going to eat or feed her daughter. And we were able to connect her with the New York City application for food. You don't have to be a senior in order to have home delivered meals.
Mhm.
And this was so important to her. Everything else was something that could be delayed, but this was something that was truly an emergency. So we were able to help her out with that.
That is wonderful. And Nancy, oh, Nancy, one more thing. Have you found that the COVID-19 responses to date have been inclusive enough of people with disabilities?
The New York City Mayor's Office for People with Disabilities has been doing a weekly phone call at 1 p.m., connecting with the disability community. And that's been, very helpful in keeping the community connected. The Department for the Aging was very responsive when we told them that many of the seniors that we serve, which of course they know, are blind and also have other chronic problems. They coordinated with us. It was a little bit disorganized in the beginning, but things seem to have been smoothed out today. Um, so I think that the city has done I would say, a good job of making sure that people with disabilities are accounted for. However, in any emergency, the lack of internet connection really is the most difficult problem for a person with disabilities. And people just don't think of using the phone anymore. And the city offices, if you call, they don't respond by phone. So everybody's remote. Now, the real divide are those people who don't have internet access.
Mm,
We're trying to do the best we can to get the information out to the blind community through our own um, participants, but also through the blindline.org, which is our information and referral system, also getting it out through the consumer groups, making sure that we're all communicating with each other. So that's been really, really helpful. The Human Services Council has been holding calls 3 days a week as a way of compiling all the information to be communicated to the city. And then they're going to the city with the questions and they're coming back to the nonprofit community with the answers. So it's been a way that we can all communicate as a nonprofit community. And then they're also hosting a call in for executive directors only so that we can talk about not just supporting our participants, but 30% of Vision staff is blind. So my job is not only making sure that we're meeting our nonprofit mission, but that we have the staff to do so. So my goal is no layoffs. We're keeping everybody busy. Everybody is getting paid. We're going to continue this as long as we possibly can. We know that the new stimulus package from the federal government has a protection program, which is going to be extremely helpful to us to keep paying people. Um, we've been given assurances from the city that they will pay us on our contracts if we continue to work with our city agencies. So I'm hopeful that our city contracts will get paid. The state, however, has not made the same commitment.
mm,
And over $2 million of Vision's $10 million budget is state funding. And in fact, the federal government that passes through the money to the state had a conference call today that basically told us they will not allow the states to pay us for services that have not been rendered. So we
mm,
will not be held harmless. So the only way we're going to be able to bring in that state funding is to provide as many services remotely as we were providing when we were doing it in home and in community. And that's going to be a tough ability to keep up, but we're working on it through all of these different remote opportunities. We do have nonprofit Google Suite. We're one of the nonprofits that Google has given all of its suite opportunities to. So we're using all of those remote access opportunities. We're sharing information amongst the staff. We're sharing information through Google Chats, Google Groups, Google Hangouts, using that as much as possible. We're using the free Zoom, but there are going to be certain things that we just can't teach remotely, like how do you teach a blind person how to cross the street safely? We can't do that until we're back out in the community.
yeah,
So we're preparing for this remote intervention to probably to continue till the end of May. Uh, if we're allowed to go back to work sooner, that'll be great. But we're expecting the next 60 days are likely that our workforce is going to continue to provide services remotely. And we're keeping everybody busy. We're taking lots of training and webinars and continuing education. We're doing all of our staff meetings remotely. I'm doing once or twice a week email to all the staff from me directly, and we're sharing resources about what can be done. And because so many of our staff are blind, a lot of the solutions that they've come up with not only work for our staff, but also work for our participants. And that's really what the goal is.
Thank you, Nancy. And to close out, can we just hear if anyone's listening to this program and needs assistance and resources, how can they get in touch with Visions?
So the quickest way is to email us info@visionsvcb.org. I'll spell that info at VISIONSVCB.org. You can also call our main number. Our toll-free number is 888-245-8333. However, it may take 24 hours before somebody will respond because, again, we're picking it up remotely and then we're giving it to the staff person that has the time in their schedule.
Thank you again, Nancy, for your time. Thanks for joining us today. And for you, the viewers, please visit visionsvcb.org to find out more and see how you can help and support Visions. That's all for our show today. We thank our guests for joining us and for their hard work serving our community during these trying times. Thank you for tuning in to BxRx. I'm your host, Sonyi Lopez, wishing you and your family safety and wellness now and always. Until next time.